Yeah, we're back and we're going to go ahead and talk to Stacy. We're having trouble getting Stacy's video. So let's go ahead and just talk to Stacy. Are you there on audio, Stacy?
Yes, I'm here.
Great.
Hi.
Yeah, hi. Can you go ahead and introduce yourself, please?
So my name's Stacy. I'm here from California, Southern California.
Great, great. And are you wearing a SCAD research t-shirt?
I am. I'm wearing one of the
Look at
ones from
that.
I got at the. Yeah, I am.
Okay, great. Yeah, we love these SCAD research t-shirts. And it's a shame we can't see it with that, but
Yeah.
I'm so sorry about the difficulties. Can you go ahead and describe to us what is your kind of connection to SCAD?
So I myself had a SCAD about 2 years ago. So the 20th will be 2 years for me. Um, yeah. I was
Can you
42
just
years
yeah,
old.
can you just
Yeah.
describe what happened?
Yeah. I was 42 years old. I had actually that year of 2018 was exercising a ton. I had lost 30 pounds. I was dieting, not dieting, but changing a lifestyle, just healthier eating. I was really trying just to focus on that. And when the incident actually happened, it was a Saturday morning. I was on the treadmill. Um, it was a weird feeling in my arm. And so I was like, this is kind of weird. What is that? Kind of a burning in my arm. And I was like, okay. So instead of running, I was walking, of course. I didn't stop right away. I'm like, it's not really going away. This is kind of weird. So I got off. We were planning on going to my niece's soccer game. So I was like doing a little clothes. My one daughter was in the shower, so I was waiting for her to get out and just kind of waiting. And it kind of went away. It was kind of there, but not really there. And I was finally able to get in the shower. And I don't know if it was the heat of the shower, it was what it started getting coming back in the arm, and it was just really weird. And I'm coming out of the shower. My husband like looks at me like because he can see something on me, and I'm like, it's just weird feeling in my arm. I said, I don't know what it is. Kind of a burning. I described it as when I would run at night, like when it's cold out, that burning you can sometimes get in your chest area when it's really cold. I kind of felt that in my arm,
Hmm.
and I was just like, this is weird. And I sat down on the bed and was just waiting and it just kind of increasingly got worse, kind of went up to more and my shoulder, more in my, just the left side of my chest area. Of course, I was anxious. I have a strong family history of heart disease. My dad had several heart attacks. His first one was at 40 years old. Um, I obviously hadn't had the health, I don't want to say healthiest of lifestyles because I was trying to lose weight. I was working on my diet. And so it's in the back of my mind. I'm also a nurse. Um, and so I just sat there and, my husband came out and he's like, you don't look good. And he's like, I'm calling 911. I'm like, no, you're not. I'm not doing this. And he finally convinced me to go and we drove. I wouldn't let him call 911, of course. And by the time we got to the hospital, it was probably about 2 hours since the incident started. And it had actually started to decrease somewhat. And of course, they got me in for labs and, chest x ray and EKG and all that right away. And chest x ray, EKG was fine, but my troponin did show some elevation. So then, of course, they wanted to bring me back in for more lab work, and it still continued. And that's when they were saying that I was having a heart attack, which I guess not surprising to me, maybe more denial for me because of my dad's history slash being a nurse. I know what they're doing, and I was just really scared at that point. I knew what my dad had been through. My dad was 76 years old. I know his life. I was like, this can't be me. I don't want to be living my life like this. He had had two open heart surgeries, and I was just really scared at that point. Luckily, it's a hospital I work at. I was treated very well from the incident. And That was a Saturday morning. 2 days later, I did go in for an angio. That went well, and that's where they diagnosed that I had a SCAD. It was actually a branch off my LAD as well as my right circumflex. And they were saying that they had thought the one off the LAD was a previous one. And that was from the interventionalist. And then the cardiologist who I saw in the hospital didn't hadn't seen it before. He's like he didn't really know. Even the nurse, they had sent me to the ICU only I think only because of me working there, not any
Mhm.
other reason. I think I was stable. Um, And the nurse was like, what did they say? I'm like, I don't know. I was hoping for more information. I don't really know. What does this mean? And they wanted to put me on, beta blockers and Plavix and the cholesterol medication, even though like my cholesterol was fine. My arteries were clear besides that. And that's kind of how it went. And I went home another day later. And just the internal med doctor who had seen me there as well, she worked with Dr. Kim was at Vanderbilt, and she had recommended me looking up some information. If I had a chance to get out there, she said that there was a lot of information out there on that, just try and look. And that's all I did, as I spent my time researching and looking. And I found Ellen, and Ellen connected me with a doctor out of Kaiser San Diego, and just, I guess, kind of put me at ease slightly.
Mhm.
I still, 2 years later, I still have that kind of in the back of my mind, but I'm kind of back to normal life. I did at-home cardiac rehab. Um,
Mhm.
I took
Okay.
I took 2 months off of work, and that was just, I had my dad passed away 6 weeks after I had my heart attack, so it was kind of a lot of things that went on.
Mhm.
Um, but I'm kind of back to normal life at this point. Like,
So, so if I can ask, they put you on the traditional drugs for heart attack patients, the people who have the atherosclerotic heart
yes.
attacks, right? Did that, I mean, did they continue with that? Was that something that, did they go through the full cycle of that?
So they wanted to. So the statin, I kind of refused. I had done some research myself looking at it, and it was kind of like maybe yes, maybe no. There was no real true like saying yes, you need to take it. My dad had a lot of problems with the statin, so I opted not to. My cholesterol was good numbers. My arteries were clear, so I opted not to take that. I did take the Plavix, and I was taking the beta blocker low dose. It was Coreg. It wasn't crazy, and I wasn't. Yes, I was tired, but I just contributed it to everything that was going on, not necessarily the beta blocker. To this day, I'm still on the beta blocker, and I take aspirin. I took the Plavix for about 3 months, but I had heavy menstrual bleeding, so we opted to stop it. I didn't, I talked with the Dr. Cavendish out of San Diego, and he was just like, "Let's just stop it. It's not, let's see how things go." And
Okay.
I was okay with that. I did well. I'm
Okay. So,
doing
so
okay.
you talked to different doctors over I mean,
I did.
yeah,
I have, I'm in so Inland Empire in California, and so that's where I get my care. But through Ellen, I was able to get connected with a
I
doctor
see.
out of San
I
Diego,
see.
and he has a lot of SCAD patients, so he knows more information.
No, the
Um,
reason I ask that is because I mean I know it sounds silly. I know we're all supposed to know that we're supposed to be our own best advocates when it comes to healthcare. But that's just something that, some families, some people, they don't go for second opinions. They stick with they stick with their guy and they don't think going out and, which is a shame because, in this, especially in something like this, you got somebody who knew what they were, knew, no, excuse me, knew the, condition much better.
right.
Through
I
your
was,
connection with Ellen, right? It was through the
yeah,
connection with Ellen you did that,
yeah.
right?
Yes, it was. I wanted more information. The cardiologist I saw him 2 weeks later, and he really didn't have a whole lot more information for me. He said he was going to when I was being discharged. I'll look it up. I'll find out more information. I'm like, okay. And I, of course, did my own research. I mean, I think because nursing background slash my own father, he was very much like an advocate for his own care. He's like he wanted answers, and I think maybe that's just how I am. But I wanted more. Not that I have any more answers today. Not that I could get any more answers necessarily. I don't know why I had it. Wasn't pregnant. Stress maybe, but it wasn't under crazy amounts of stress that time. I had already been through like a couple years prior. I mean, there was nothing currently at that point in time that I was really struggling through. Work is
Hmm.
stressful, but I think we all kind of have different stressful periods in our time. Um, but I just my motto I tell people is I'm good, I guess, until I'm not, because you really don't know. You can't like say it's coming. It can happen. So I do my best to stay healthy. I exercise at least 4 times a week. Of course, work is difficult with that sometimes, but
Hmm. Now,
those are my things. Yeah.
now they
Go
also
ahead.
did you also did the cardiac rehab. Again, was that
I
kind of the traditional, or how did that go?
So it was at home. So we talked about it, and he was like, "So you can come in like 3 times a week or this," and I'm like thinking, I'm like, "How am I going to go back to work? How am I going to do this? How like it's going to be really difficult." So they set me up with it at home, where they gave you a smartwatch and it could monitor your heart rate. They gave you parameters with it. And I was able to do it that way. And I think that really helped psychologically that I was going to be okay doing it. And that kind of, of course, the first week, because I think I started cardiac rehab about 2 weeks out. And so I was nervous a little bit. And I just started doing that. So I started doing like, slow walks and, a mile walk, and I was doing okay. I met with the nurse at least once a week over the phone. Um, and then if I had issues, I was able to, through Kaiser, you can email your doctor, you can touch base. And I had started at cardiac rehab. I had spoken to my cardiologist here. I had been out. I was making an appointment to go see the cardiologist out in San Diego. I was doing well, so I think the cardiac rehab is really good for you mentally to let you know you can push your body a little bit. Um,
Okay, good,
yeah.
good. And you weren't in a room with 70-year-olds, right? Which is,
Right, right.
yeah.
Even when I first met with the cardiac rehab nurse, she was like, "Why are you here?" She hadn't heard of it. She
Mm,
wanted to still talk about a lot of the things traditional. A lot of the information they sent me was traditional,
okay.
and I'm like, yeah, okay. They wanted to send you to the healthy eating, and I'm like, okay, so I already try that. I'm like, you know what I mean? I've been exercising. I've been doing this. I really want to make sure I can still exercise. Can I go for the walk? Can I go for the run? Am I safe to go to my kids' soccer practice?
Mhm.
Because that's where I did a lot of my walking is when they were practicing. And am I going to be okay to do that?
If I can ask one last question, really, is what the kind of the path forward for you? We hear a lot of people say the emotional toll can be heavy, and sometimes there's just physical challenges. What works for you? What's been helping you the most as are recovering from this incident?
Um, First of all, I consider myself lucky. I think I had one of the, compared to a lot of stories I hear, I had one of the mild cases. I feel like I just know, like, I can't live my life in that zone. Like, I can't do these things, or wonder if it's going to happen again. It's always in the back of my mind. It's always there. It's always going to be there. And I think you just have to have that forward outlook. I have a lot of good support between my family, my coworkers at work, my other like leadership team. They're very good with me. They watch, they look, so I know that people are there. They're watching. I just feel like I can't sit there and not live my life. And yeah,
Yeah.
that's what it is. I have young kids. I have a 12-year-old, a 15-year-old. I want to be there for them. I want to do things for them. Of course, I can't change this. So I do know with the family history that I need to make sure I stay well and exercise and eat well. So those are my, just do what I know is good for myself. That way, hopefully preventing things.
Hmm. Okay,
Yeah.
great. Well, thank you so much, Stacey. We were just talking to Stacey, who, as you can see, her camera is not giving us good results today, but I really appreciate you joining us. It's a shame we can't see your SCAD research shirt and your face, but thank you so much for joining us.
Okay. Thank you.